Millions of Americans have been vaccinated against COVID-19, but the race is on to boost those numbers. Some people may be hesitant or lack confidence in the vaccine, but many more are simply facing barriers to getting the shots. Joining me to talk about breaking down those barriers are three experts from Blue Cross and Blue Shield of Minnesota. They've been taking vaccines directly into communities and offering much more than just a shot in the arm. I'm Kristen Gourlay with the Blue Cross Blue Shield Association, and with me today, Maria Regan Gonzales, an expert in population health and the mayor of the city of Richfield, Nash Sheikh, Chief of Staff to the President and CEO of Blue Cross and Blue Shield of Minnesota, and Dr. Mark Steffen, who is the Chief Medical Officer and a Vice President at Blue Cross and Blue Shield of Minnesota. Thank you all for joining me.
Thank you.
Thanks, Kristen.
Thank you.
So let's dive right in. Nash, I'd like to start with you. So can you just describe the basics of the vaccine bus project for us?
Absolutely. Kristen, as you started off and said, access to COVID-19 vaccine is one of the biggest barriers standing in the way of equitable rates of vaccines in Minnesota. And this bus has been a very unique and innovative way of reaching out to the population that is hard to reach and the vulnerable population in Minnesota. This bus is a partnership between the state, MDH, Metro Transit, and Blue Cross Blue Shield of Minnesota. We have about 700 of our associates who are excited and ready to be part of this effort, both clinical and non-clinical. But I want to start with the bus, which is the kind of the hero or the clinic in this space. When we looked at the bus in the beginning of the year, we looked at the bus which had an accident, and the part which is right above the tire was ripped off. And it was very difficult to imagine a bus over there. But we had the blueprint and the layout and pieces of paper that talks about, here's the table, here's where the nurses will be, and here's how we'll be having the setup and everything. 4 weeks later, Kristen, this bus was in a transformation. It was amazing just to see what it has transformed into with clinics, beautifully kept everything stacked in there. So it was just ready to rock and roll. It was emotional, like seeing your kids grow up, not of course in 4 weeks, but it was phenomenal just to see how things are progressing, and the bus was ready to be on the road. Mid of April, when we started this project, we started with about 2 buses, and then we started increasing. Now we have about 6 buses that are on the road and helping and serving the hard to reach population. We are giving both Moderna and J&J. Of course, the best vaccine is the one that is approved and available. So it's been going great from the bus project, and people just have a very heartfelt, emotional just to see the bus around.
Incredible. Mark, I'd like to turn to you. Can you tell us how you identified communities that might benefit from having just a bus pull up to their doorstep or their workplace?
Yeah, Kristen, thanks. When we looked for communities, I think we started, and I'll go back to something that Nash said, we started with grounding ourselves on what our mission was, and that was really to improve equitable vaccine delivery. And the Minnesota Department of Health and Blue Cross had deep alignment that this was the goal for these buses. And then we took a data-driven approach. There's something called the Social Vulnerability Index that describes demographics and characteristics of communities and zip codes that may indicate that people will have more barriers to getting the vaccine and indicate the social vulnerability of that community in total. Certainly, as we identified those individual communities, this was a close collaboration with the Minnesota Department of Health. And I think the other important factor was the deep grounding that we had in the communities that really helped us identify which ones would benefit the most. And historically, Blue Cross of Minnesota has been deeply engaged in community efforts across the state, both with the foundation as well as our Center for Prevention. And the Minnesota Department of Health has exquisite connections very deep into the community that helped us identify those optimal places to bring those buses where we could drive the most impact.
Very targeted effort. Maria, I'd like to come to you. One of the communities you reached is in an area with low-income housing in Richfield. You happen to work for Blue Cross and Blue Shield of Minnesota and be the mayor of Richfield. Can you tell us first just a little bit about that area, and also a little bit about some of the barriers people in that area might have been facing to getting vaccinated? And we'll get a little bit more into barriers in just a moment, but I'll start there.
Yep. So the area in Richfield is in the core of the Twin Cities, and it's right on our 494 interstate, right along the highway there. And it's actually designated, I don't think we use this term anymore, but it was previously designated by the state as a racially concentrated area of poverty. And so that area, and it's also a hard to count census tract. So essentially we have a lot of community members that are living there. Many of the community members are immigrants, refugees, community members of color living, and we have a pretty big apartments right in that area. And so there's thousands of community members and households right in a small area and in this part of our town. And so in terms of barriers for this community in our city, but also this is very similar to communities across the state, it's not about vaccine hesitancy. It's about overcoming all the different barriers to getting the vaccine. So whether it's childcare, it's hours that work with your schedule, it's being able to talk to somebody in your own language and ask questions, going to a place where you feel that it's safe and trusted. So making it easy overall, popping in and popping out. Those are all the barriers that we've been seeing in our community. And those are all the barriers that we've been able to reduce when you have an initiative like this one that is partnering with longstanding trusted community partner organizations from those communities, speaking those languages, having that culturally appropriate connection, rolling up in a bus in your own backyard, literally, where you can come and bring your kids, you can come and talk to your landlord or somebody you know that you trust and say, hey, I want to ask some questions. Oh, let me go talk to my neighbors. People literally went and said, I'm going to tell people, and can I bring my family? Do you have various options? So those are some of the things that we saw as barriers, and those are some of the barriers that we were able to remove in getting people vaccinated.
I want to follow up on that and then give other people a chance to weigh in. Some of the narrative we hear in the media and elsewhere is that, you know, the remaining people who need to be vaccinated are just, they don't have confidence in it, or they're hesitant to get vaccinated. But what I hear you saying is with certain communities, that's not the issue. It's barriers. Can you tell me a little bit about that?
Yeah, I think this is a common stereotype that we have in a lot of areas, whether it is voting, community engagement, being on a PTO. It's really easy to say, you know, people are just not interested. But what we don't understand is that the spaces that we design are not designed for people who are not English speaking, for people who work third shift, for people who are balancing multiple roles and responsibilities. And so really making sure that any initiative is easily accessible to all different kinds of people is really important. So another example is in that same area, we have a high-rise apartment complex that is mostly the residents are community members with disabilities. So, you know, bringing this bus, working in partnership, we gave seed starters because they have raised beds in their community. And we said, hey, come and get your seed starters for your herbs and plants. But it's also right there in their own backyard where they don't have to worry about a lot of those accessibility issues with, you know, walkers and with wheelchairs and things like that.
Nash, let me come back to you. You were on the bus. You've been on the buses volunteering. Do any memorable interactions come to mind for you for people with people who were getting on the bus, maybe had not had a chance to even think about scheduling a vaccination appointment, something along those lines? What comes to mind for you?
So yeah, Kristen, that's a very good question. You know, one of the biggest part of this project is all the stories that you get at the end of, you know, the vaccination day. And I could think about a couple, but one of the things that stood out is we were at a farm up north in Minnesota, and looking at giving shots to the migrant workers over there. These are people, just like Maria mentioned, right? These are people who are little to no English, and working over there hourly. It's very difficult for them to just come out and drive a couple hours and get a shot. So when we pulled the bus over there, it was so humbling just to see that these people are in the farm a minute, and then a minute later they are standing in queue to get a shot. So once their shots were done, we had this opportunity to talk to them and find out what their story is. And most of the people were just thankful for us to be there. I mean, these are people who are not going to drive to a mass vaccination site. These are people who don't have time to go and get their shot. So they were just happy that we were there. They were able to take their shot, ask questions, and then just go back. So it was humbling just to hear that story. And the other one that I could remember of is probably a young mother with 4 kids that walked to the bus and got her shots done. And she was there with younger kids, and it was just we asked her, and she said she just don't know how to drive. And it was all this heartfelt and emotional story makes this project so invaluable for what we are trying to do, to listen to these stories. Because one of the workers did tell me, had it not been for the bus, they had not gotten the shot. So eligibility is not equal to accessibility. So I think this bus is making an impact for sure.
Yes. Mark, that brings up a question for me. We've seen just a massive vaccination effort across the country, mass vaccination sites, health systems rolling out their own programs, pharmacies. I mean, if you look on the surface, vaccines have been distributed far and wide, but it seems to me, and tell me if this squares with your experience, that this next phase of the effort is getting vaccines that last mile, getting vaccines to people who just can't make it. And that's door to door, that's bus by bus. Tell me a little bit about your experience with that. What do you make of that?
Yeah, I think it's spot on, Kristen, and I'll say it was really anticipated. We went in to a very vaccine constrained environment where people were going to great lengths to get appointments, to get vaccinated. And as we've worked through this very engaged portion of the population who probably didn't face the barriers that people face that we're vaccinating now, we knew it was going to be more of a challenge. And I think it really shows the need for authentic community engagement and meeting people where they're at. And I think as we get into this last mile of the pandemic, it is going to be these smaller, localized, community-focused efforts that can really help us have success in vaccinating everyone in the state and certainly in our country.
I'd like to pose this question. We're going to wrap up soon, but to each of you, this pandemic, I think we've all seen, and the role, including the rollout of vaccines, has really laid bare some fundamental racial inequalities and other kinds of inequalities in our healthcare system and in other facets of our society. Before COVID-19 ever became a word that was, a household name, right? Could we take something from this experience, from getting the bus into communities, from getting care directly to communities, that you might be able to use to tackle other kinds of disparities? What's the thinking right now, Blue Cross and Blue Shield of Minnesota, or amongst your other healthcare colleagues in the state? And whoever wants to jump in to take that first, please.
Yep. Maybe I'll start, and Nash and Maria would love to hear your voice on this. I think at the beginning of the pandemic, there was a lot of surprise that we saw such deep racial disparities in who was being impacted by COVID, but we really should not have been surprised. These health disparities have existed for a long time. In Minnesota, we're blessed with one of the highest quality healthcare systems, but unfortunately, we also have some of the largest health disparities in the country. And we really need to reflect and look at what's causing these. Certainly, there's the barriers that people face, but we also need to look at, are there institutionalized racism that is impacting the care that's being delivered to individuals and really disproportionately impacting especially our Black, Indigenous, and other people of color populations that are negatively impacting their health outcomes. And I think it's really given us the opportunity to have that both highlighted, in a very unfortunate way, but it's been good to see the community, the provider community, the state really rally around taking COVID as an example where we can make a difference and try to eliminate some of those disparities.
I'll just add a couple things. So as Dr. Mark Steffen said, this is something that these deep racial inequities have existed in our country since the beginning. And I would just say it would be a complete disservice and lack of social responsibility as healthcare providers or anybody in our country, to be honest, to say, to want to go back to the way that things were. Things previously were very inequitable. And what we learned with COVID was that when those inequities affect everybody, largely including white communities and not just people of color anymore, we all of a sudden can do things that we previously thought we couldn't do before. Things that we said, nope, hard, it's too long, we don't have the resources to do that. We literally changed overnight. Massive amounts of change across all institutions globally. And we were able to do it, and we were innovative, we were nimble, we were adaptive, and we used the resources that we had. And so to go back and say we can't do that, or these inequities don't exist, is just not an option anymore. And we must work differently. And what we're seeing is that has to be done to cater to the communities most impacted, and that we may not have trust in those communities. We don't have trust oftentimes in those communities for very important reasons, and that anything we do has to be done in authentic partnership with communities. That has been the success in saying what makes sense, you lead the way, we're here to provide reinforcement and support. And I think that model that we've showed to be successful with the vaccination bus is something we should be applying in any field.
Yeah, I think the experts have spoken. Most of the points they said, I completely agree. And after doing, I mean, this is me from a data perspective, is after doing 78 zip codes and about 28 counties and serving more than 5,500 people, I think, like Dr. Marks said, that it is true, this was always there, but this COVID situation has just uncovered some of the things that was already there. But within zip code too, it is very different to see, how it still exists, the inequality still exists. So the learning from this is how we can still look at communities, each community differently, and how we can build that trusted relationship that Maria mentioned. So a lot to learn from this project, but definitely a successful one, which is making an impact on the racial and health equity.
I want to leave it there. I want to thank all of you so very much for sharing this experience. Thank you so much, Maria Regan Gonzales. You are once again the mayor of Richfield and also a population health expert with Blue Cross and Blue Shield of Minnesota. Nash Sheikh, also with Blue Cross and Blue Shield of Minnesota and chief of staff to the president and CEO, and Dr. Mark Steffen, the chief medical officer and also vice president at Blue Cross and Blue Shield of Minnesota. I'm Kristen Gourlay with the Blue Cross Blue Shield Association. Thank you for joining us, and we'll leave it there. Thanks so much, everyone.
Thank you for having us.
Thank you.